earlier on, when we began to hear about the pandemic being one that was transmitted by travelers coming through and through the various borders, i.e. the airport and the land borders, we began to really kickstart and put in place things around our contingency planning and making sure we had a crisis committee set up immediately to begin to, be more aware of everything COVID related. So what we did as a business was to really begin to identify the original source of information around COVID, for example, World Health Organization, the Ghana Health Service, et cetera, to really have authentic information around everything COVID. Second thing we did was to really learn from the countries where COVID was very prevalent, i.e. China, America, Italy, and so on and so forth, to sort of learn how they were dealing with the crisis, because at the early stage of the pandemic, it was very different to what we have today, where we have a better understanding about how the virus even behaves, So we had to really gather a lot of information around that and ensure that from an education perspective, we educated all our employees and encouraged our employees to also educate their stakeholders or their significant others, being the larger community, their families, where they interact, and so on and so forth. At the time that COVID became very clear in Ghana, we didn't have a lockdown system. We didn't have, whether it's physical distancing or social distancing. But what we knew was if you wore the face mask and you wash your hands regularly with soap and running water in a particular way, thorough washing of hands, and also sanitize regularly, you'll be able to protect yourself and others from the pandemic or from the virus. So other things that we did was to really even find out the type of alcohol that was really very potent to be able to clean viruses very well. We realized that there are so many sanitizers on the market today. The alcohol content of these are not necessarily the same. Other things we did was fumigating the entire campus or the entire factory, even air fumigation, which I didn't even know about, till this pandemic. We fumigated the whole, office environment, the air, to make sure that, people were safe, because for us, people is our most important priority. All these things came under our crisis management approach, because when you have a pandemic of this sort, you need to quickly kickstart into place and into motion things that protect first your people. So we had constant education. We had medical people coming through to give talks, to give counseling, to sort of also manage the anxiety that comes with, the pandemic. Dr. Kaba mentioned something that was very, very important in terms of commuting to work and where people find themselves outside of the office. And for those who have drivers and have, nannies and housekeepers at home and all of that, there are various angles through which you can actually contract the virus. At the time also, mosques were open, social gatherings were not limited. We had churches opened, we had large funerals, we had large weddings, we had all kinds of social engagement. So the education started with our employees to make sure they were self-protecting and also being advocates and icons for others to protect themselves. So information sharing was very, very critical. We shared information from TV screens, from WhatsApp platforms, from town hall meetings, from newsletters, from emails, from all kinds of information all the time on what COVID was and what COVID was not, and to sort of break the myths around COVID and also bring more truth to what COVID was really about. So it was a very strong intervention we put in place. Now, you mentioned me working for an FMCG. So FMCG, this one is about making food, and food that goes, was consumed at a very high rate. So we had to review again and still step up, which was already high, how we managed our staff who handled our food, for example, just to make sure that there was no stone left unturned. We also put in place all kinds of things like Veronica buckets all over the place, our hygiene centers in all our RDCs, and all our agents were, also educated. So it was really, really very, very critical. In all of this, what was important was the constant decision tree and the constant checklist to make sure that all the items that we highlighted as possible risks and areas of concern were properly ticked off, and all of that. Also in compliance with not only global standards, but whatever standards the Ministry of Education, the Ministry of Employment, and Ministry of Trade and Industry were publishing as guidelines about how to manage the workplace. So these were some of the things that we put in place to make sure that we kept our employees very calm and protected, and also continuously engage them to be aware of what the risks of having the pandemic were about.
Would you say you've brought it under control in your organization?
It is under control. It is under control because we have not recorded, cases that, have, ended up in the very unfortunate situation that Russell found himself in. So if you continuously create a consciousness, it becomes a habit. This pandemic broke out in December in Ghana. First case was in March. With a constant indication after 21 days, this practice becomes a lifestyle, a habit. So you actually find people, wearing masks all the time. And there are times that even have the physical distance, or they are really, really like one person in a meeting room and they're wearing a mask because they become so aware that they have to protect themselves. So there was no stone really left unturned in terms of how we managed this. So we really have it under control.
How do you manage something like physical distancing, as Noella would want to put it?
So the measurements she mentioned are really apt in terms of the 1 meter, the 2 meter distancing. We had to reorg seating positions in the offices. We had to even shut down the office and make sure people worked from home. So our IT staff had to set up, for those who didn't have laptops and working with desktops, have their workstations at home. We had to make sure we had connectivity and data given to employees, and also train them about how to work from home, the discipline about working from home, how to manage your time, how to, manage the other pressures like family life, children who were doing online studies, spouses doing online jobs as well, in a way that people were fully present to deliver unexpected outcomes. Also to manage anxiety, because the thing about this pandemic is, even if you are protected, you would always hear about some family friend or somebody who's passed on or who's contracted the virus, and that was also bringing a certain level of anxiety. So we had to manage, that stress that came with it. Also, we had to manage how line managers are, given workload and all of that. So these were some of the distancing opportunities, even in the canteen and factories, how people were seated on the factory lines. We had to slow down the lines and create spacing to ensure that as the belts were running, they would run at a pace that didn't require people to break the protocols around the distance that was required for them to be close to each other. So these were some of the initiatives that we put in place to ensure that we indeed put this under control.
Now, how do you manage a situation where you have a case and some staff have to go into self-quarantine, which means that they will not be available as a human resource? How do you deal with that?
Okay, so let me just say that in terms of self-quarantining, it is not peculiar to COVID, right? Self-quarantining is actually relative to every disease that's communicable. So if you have somebody with very bad flu, or somebody with very terrible cough, or any communicable disease or any airborne disease, you have to self-quarantine. So we have demarcated places where if anybody was showing any symptoms of any communicable disease, they would actually be isolated there until they're evacuated off-site. But given the COVID situation, we've had to actually make a conscious effort to educate everyone through communication that if anybody was showing any symptoms of the COVID virus, that is the place where you'd have to be self-quarantined to temporarily while we get the doctors on site. We have a health clinic on site where the doctors would quickly, come and support and make sure you're evacuated and giving the right support to the places that Russell mentioned in his discourse in terms of the isolation and all of that. So that's what we've put in place in terms of self-quarantining. Plus the education around, if you're coming to work, for example, and you begin to feel sick, don't come at all, stay at home. Or if you come to work and you feel sick, you self-quarantine and you go straight to the clinic to have, yourself checked out and given the necessary attention. So this is what we've done around self-quarantining, and the education there is very strong. And it doesn't come with any stigma. If anybody is not feeling well, they're able to feel free to, report and have the necessary attention given them.
Now, from where you sit, you're also a HR consultant. Are there practices that some companies are engaged in that you think are undermining efforts to curb the spread and probably fueling the spread of it?
The practices that undermine the effort of the spread of corona is when you focus on the business more than the people. Because you put your lenses on the business and then you don't educate, you don't spend time to put your crisis management in place, your business contingency plans, your physical social distancing, all the education on wearing masks and all that, and even invest in, upping the sanitization efforts. You put your business at risk because it is people who drive the business. If your people are unwell, where lies your business? So any business that fails to prioritize people in this pandemic and prioritizes their profits or their targets or their expansion capacity or their innovation is actually putting their own business at risk. And eventually, they would actually have a decline in terms of business performance.